Did you know that some common medications, taken daily by millions of seniors, can triple the risk of stroke? This information isn't on the labels. Many doctors don't even mention it during routine checkups. But the danger is real, and it could be inside your home, in your own medicine cabinet. According to the Brazilian Society of Cerebrovascular Diseases, stroke kills over 100,000 Brazilians every year. And the most alarming part? More than half of the victims are over 60. The good news? Many of these cases could be prevented with one simple step: avoiding the wrong medications. If you're over 60, or care for someone who is, pay close attention. There are 4 medications that are especially dangerous for seniors' brains and blood vessels. And the most dangerous one will only be revealed at the end of this video. For those just joining, I'm Dr. William Tharnell, a specialist in senior health with over 25 years of experience in geriatrics and integrative medicine. What I'm sharing here is based on recent scientific studies and thousands of real cases I've seen throughout my career. If you value your health and want to keep receiving valuable tips like this, hit the like button, subscribe to the channel, and turn on notifications. And while you're at it, comment below how many medications you take daily. You could be at risk without even knowing it. Now, let's understand why stroke is so dangerous at this stage of life. A stroke, also known as a brain attack, occurs when blood stops circulating properly in the brain. This can happen for 2 main reasons: either a blood vessel ruptures, causing bleeding, or a clot blocks blood flow. The problem is, when this happens, millions of brain cells begin to die within minutes. Every second without proper circulation means less oxygen to the brain and more irreversible damage. For seniors, the risk is even higher. Over time, blood vessels become more fragile, and blood pressure tends to rise. Additionally, many seniors already live with conditions like diabetes, high cholesterol, or heart arrhythmias, which further increase the danger. Another critical factor is that the body of someone over 60 doesn't react as quickly as a younger person's. That's why strokes in this age group tend to be more severe, more extensive, and harder to recover from. Global data shows that about 1 in 4 adults will have a stroke in their lifetime. And the older you get, the higher the chance that this event will be fatal or leave lasting damage like paralysis, speech loss, or difficulty walking and thinking. The good news is that most strokes can be prevented. And one of the most important steps is to immediately reevaluate the use of certain medications that directly affect the brain's blood vessels. In the next chapter, we'll discuss the first of these, a type of medication many seniors take without realizing the risk. Medication 1. Antipsychotics, a silent risk. Antipsychotics are often prescribed to control agitation, confusion, hallucinations, or even aggressive behavior. They're frequently given to seniors with dementia, Alzheimer's, or severe anxiety symptoms. But what few people know is that these medications profoundly alter brain function and directly affect blood vessels. International studies show that long-term use of antipsychotics in people over 60 can triple the risk of ischemic stroke, the kind caused by blocked blood flow in the brain. A study published in the British Medical Journal, analyzing over 75,000 seniors, found that the risk is highest in the first few weeks of use. The body hasn't yet adapted, and the brain suffers the direct impact of the chemical imbalance caused by the drug. Additionally, these medications can slow heart rate, alter blood pressure, and impair proper circulation, all factors that promote clots. Common names include haloperidol, risperidone, quetiapine, and olanzapine. Often, these drugs are prescribed without patients or families being informed of the risks of long-term use. Worse, many seniors don't even have a clear diagnosis of psychosis. They may just have temporary agitation or confusion, yet they're given an antipsychotic to calm them down. This is dangerous. Imagine this scenario. Dorothy, 76, started getting confused at night. She was taken to the ER and prescribed risperidone to control her behavior. 3 weeks later, she had a stroke during breakfast. Only then did her children discover the link between the drug and the stroke. Cases like this are more common than you think. So, if you or someone you know is taking this type of medication, it's crucial to talk to the prescribing doctor and explore safer alternatives. In the next chapter, we'll discuss an even more common type of medication, used by millions of seniors worldwide to sleep, but which can also be a hidden danger. Medication 2. Benzodiazepines, the sleep that can kill. Poor sleep is a common complaint among people over 60. Many struggle to fall asleep, wake up frequently, or feel tired even after resting. That's where benzodiazepines come in, a class of drugs widely prescribed worldwide. They're given for insomnia, anxiety, and tension. And yes, they work in the short term. But what few people know is that, over time, they can cause severe, even fatal, side effects. Research published by the American Heart Association shows that long-term use of benzodiazepines in seniors is linked to a significant increase in stroke risk, falls, confusion, and excessive sedation. These drugs act directly on the central nervous system, broadly suppressing brain activity. This can lead to reduced reflexes, lower blood pressure, and decreased cerebral blood flow, factors that together promote clots or ruptured vessels. The situation worsens because the body builds tolerance over time. A dose that once worked no longer does, leading to higher doses and higher risks. Common benzodiazepines include diazepam, clonazepam, alprazolam, and lorazepam. Many know them only by brand names. Taking just a drop at bedtime, or a pill to relax, may seem harmless, but the effect on an aging brain can be devastating. Mercedes, 81, took clonazepam every night for 3 years. She'd never had serious health issues, until one Sunday, she woke up unable to speak or move the right side of her body. It was a stroke. At the hospital, doctors explained that benzodiazepines had contributed to the event. Stories like this aren't rare. Unfortunately, they're becoming more common. Beyond stroke risk, benzodiazepines are linked to nighttime falls, fractures, memory loss, and even early dementia. That's why many countries now recommend avoiding them in seniors whenever possible. There are safer, natural, and more effective ways to improve sleep. But before making any changes, the first step is awareness. The second? Talk to your doctor. Next, we'll discuss an older type of antidepressant still widely prescribed to seniors, but which can pose serious risks to the heart and brain. Medication 3. Tricyclic antidepressants, a threat to the heart. Many believe antidepressants are only for severe depression, but in reality, they're also widely prescribed for chronic pain, insomnia, migraines, and even menopause symptoms. Among the oldest and still commonly prescribed are tricyclic antidepressants. While effective in some cases, these drugs carry significant risks for those over 60. They don't just affect mood, they also impact the cardiovascular system and brain function. Research from the University of Nottingham in the UK shows that tricyclic use in seniors is linked to a sharp increase in stroke and heart attack risk. This happens because these drugs can trigger arrhythmias, blood pressure fluctuations, and thickening of blood vessel walls. Additionally, they lower the nervous system's alert threshold, making the body more vulnerable to sudden drops in blood pressure and disorientation, extremely dangerous for those with existing circulatory or brain fragility. Amitriptyline, nortriptyline, and imipramine are classic examples. Though many doctors still prescribe them because they're cheap and familiar, the health cost can be too high without strict monitoring. Frank, 74, started taking amitriptyline for back pain. Within weeks, he felt more tired, dizzy, and forgetful. He ignored the signs until an unexpected fainting spell landed him in the hospital. There, doctors found he'd had a mini-stroke, a silent warning from his body. This is the kind of warning we must take seriously, because the body of someone over 60 doesn't bounce back like it used to. Small chemical changes can have major impacts. If you or someone you know is taking these medications, it's essential to discuss with a doctor whether there are safer, modern alternatives with fewer side effects. Next, we'll cover a type of medication that seems harmless because it's sold over the counter, but which can severely damage seniors' vascular systems. Worse, it's part of millions of people's daily lives. Medication 4, non-steroidal anti-inflammatory drugs, NSAIDs, the enemy of arteries. Knee pain, back pain, joint pain. As the body ages, it's common to deal with daily discomfort. That's why millions of seniors worldwide take anti-inflammatory drugs for quick relief. The problem? NSAIDs, non-steroidal anti-inflammatory drugs, though seemingly harmless, can seriously harm cardiovascular health, especially after 60. Medications like ibuprofen, naproxen, diclofenac, and even certain types of aspirin are widely used without proper oversight. Many are available over the counter. But studies in the Journal of the American Medical Association show that frequent NSAID use in seniors is linked to up to an 84% higher stroke risk. NSAIDs can cause sodium retention, increased blood pressure, blood clotting changes, and kidney strain, all of which promote clots and ruptured vessels, especially in the brain. Margaret, 68, took ibuprofen almost daily for hand pain. She gardened, cooked, and cared for her grandkids. Everything seemed fine, until one morning, she collapsed in the bathroom and couldn't get up. At the hospital, the diagnosis was ischemic stroke. She'd never been warned about the risks of long-term NSAID use. Occasional, controlled NSAID use may be safe. But for seniors, the danger starts when use becomes habitual. Many take them daily without guidance, thinking it's just a little help for pain. That's when the risk becomes invisible and deadly. So, never self-medicate. Don't refill old prescriptions without consulting your doctor. And don't underestimate the effects of seemingly simple medications. In the next few minutes, we'll explore why these risks escalate after 60 and what changes in the body make seniors more vulnerable. As the body ages, it undergoes deep changes, many invisible, but with direct impacts on blood vessel and brain health. That's why stroke risk rises so sharply after 60. First, arteries naturally lose elasticity. Over time, the vessels supplying the brain become stiffer, less able to expand and contract. This impairs circulation and increases arterial pressure, raising the risk of ruptures or clots. Additionally, the heart works less efficiently with age. Any extra strain from poorly prescribed medications, high blood pressure, or irregular heartbeats can have immediate, severe consequences. Another critical factor, seniors metabolize drugs more slowly. Chemicals stay in the bloodstream longer, amplifying side effects. Medications once well tolerated may now linger dangerously. Finally, many seniors take multiple medications simultaneously, a practice called polypharmacy. Drug interactions can be hazardous, especially without regular medical supervision. Think of the body like an aging machine needing finer adjustments. Yet many seniors treat isolated symptoms with strong drugs, ignoring the toll on a more sensitive system. Frank, for example, took 8 medications daily, including an NSAID, a sedative, and an antidepressant. No doctor ever reviewed the full combination. At 73, he had a mild stroke. Only later did tests reveal the drugs were overloading his circulation and brain. Understanding age-related changes is key to safer decisions. Symptom control isn't enough. You must see the big picture and act before warning signs appear. Now, let's cover the symptoms that precede a stroke and how to recognize them in time. This knowledge can save lives. Stroke warning signs. Don't ignore these symptoms. Strokes rarely happen without warning. Often, the body sends signals, small alerts that, if ignored, can escalate to a major event within hours. Recognizing these signs quickly can mean the difference between recovery and permanent disability, or life and death. The most common first sign is sudden weakness on one side of the body. An arm or leg goes limp for no apparent reason. It may last seconds or minutes. Never ignore it. Another symptom is slurred or jumbled speech. The person may mumble or say incoherent things. Sometimes they don't even notice, but those around them do. Sudden tingling in the face, arm, or leg, especially on one side, is also common. This often precedes more severe paralysis. Vision changes are another red flag. Blurriness, partial vision loss, or double vision may be mistaken for eye strain but could signal something worse. A sudden, severe headache with no clear cause, especially with nausea, vomiting, or confusion, is another critical warning. There are also mini-strokes, TIAs, where symptoms last minutes and then vanish. But this doesn't mean the danger has passed. On the contrary, it's a clear sign that a major stroke may be coming. This is the exact moment to seek medical help and review medications. Ethel, 77, felt numbness in her left arm for a few minutes. She blamed it on sleeping wrong. The next day, she had a hemorrhagic stroke. Today, she lives with avoidable disabilities. If you or someone you know experiences any of these symptoms, don't wait. Go to the ER immediately. Every minute counts. After all this, the natural question is, what can be done? The good news is there are ways to drastically cut stroke risk, and many start with simple steps. First, always consult a trusted doctor. Never stop or switch medications on your own. But bring this information to your appointment and ask, is this still the best medication for me? Are there safer options for my age? Today, there are modern alternatives for nearly all the drugs we've covered. Newer antidepressants with fewer cardiovascular effects, natural or gentler anti-inflammatories, non-drug therapies for insomnia, and treatments for senior agitation that avoid antipsychotics. Regularly review your medication list. If you take 5 or more drugs daily, you're at higher risk for dangerous interactions. Ask your doctor or pharmacist for a full reevaluation. Sometimes what helped before may now be harming you. Also, invest in habits that naturally support brain and heart health. Light walks, hydration, a diet rich in vegetables, fruits, and healthy fats. Avoid excess salt, prioritize sleep, and stay socially active. All this helps keep blood vessels healthy. Dorothy, 80, had taken benzodiazepines for 6 years. After talking to her geriatrician, she began a gradual taper, adding breathing exercises and melatonin. Within 2 months, she slept better, felt more energetic, and most importantly, slashed her stroke risk. Another key step: control silent conditions like hypertension, diabetes, high cholesterol, and heart arrhythmias. Often, stroke risk stems from these factors combined with inappropriate medications. Keep up with checkups and follow your doctor's advice. Never dismiss mild symptoms. Even fleeting tingling, unusual dizziness, or speech changes deserve attention. The sooner you act, the better the outcome. Finally, keep a family member informed about your medications. In an emergency, this knowledge can be life-saving. If you've made it this far, you value your health and want to live with independence, clarity, and quality. That's the best mindset for anyone over 60. Stay informed, prevent, and act wisely. Let's recap the 4 high-risk medications. Antipsychotics, prescribed for agitation or confusion, but significantly increase stroke risk in seniors. Benzodiazepines, taken for sleep or relaxation, but depress brain function and may trigger strokes. Tricyclic antidepressants, disrupt heart rhythm and blood pressure, posing dangers to aging brains. NSAIDs, though common, they impair circulation and promote clots or vessel ruptures. These drugs aren't banned. In some cases, they're still necessary. But that's exactly why they must be used with extreme caution after 60. If you or a loved one takes any of these, seek medical guidance and explore alternatives. Often, newer, safer options exist. Stroke is a major threat in later life. It can strike suddenly, but it usually gives warnings first. Knowing the risks and acting in time can prevent the worst. You don't have to wait for disaster to strike. Start today. Review your medications. Schedule that overdue doctor's appointment. And share this with someone who needs it. If this video was helpful, like it now, subscribe, and turn on notifications. That way, you'll keep getting exclusive health content tailored for those who want to age safely and well. Taking care of yourself is the first step to continuing to care for others.